personally, just wanted to give a little introduction about myself. My name is Mike Gallagher. I am a certified lifestyle educator. I've been in the nutritional industry for almost 20 years. I'm only here during the wellness weeks. Normally I travel around to different healthcare practitioner offices and I show them the research. I show them the science, show them the studies, and we try to implement nutritional programs in the different healthcare practitioner offices. So I work with all different types of modalities. I work with medical doctors, I work with DOs, I work with pharmacists, I work with nutritionists, I work with naturopaths, I work with kinesiologists. And so everybody has their own way of doing things, their own way of looking at things. And again, so if you are looking for any of those modalities, come see me afterward. If you're already working with someone that you feel would be open for me to go see them and talk to them, I would be more than happy to, so let me know that as well, okay? So today we wanted to talk about GI. This is a huge central part of the healing process. Most issues, we start with the GI. And if our GI tract is not strong, if our GI tract is not working properly, if we're not digesting, or if we're not absorbing, okay, then it really doesn't matter what supplements we're taking, they're not going to be the most effective. So we usually always start with GI first with any modality, with anything, okay? And this is actually how naturopaths feel. Naturopaths feel everything is GI related. And so if you have multiple problems, multiple issues, we always start with the stomach. We always start with the stomach first and foremost. It's an integral part of everyone's health issue. And of course the diet obviously is huge. So there's a big difference on obviously what we're eating. So obviously with fruits and vegetables, Mediterranean style diet, that's what we recommend with majority of our programs. Nothing crazy, nothing exotic, lean proteins, chicken, turkey, fish. Know your sources, organic or wild as much as possible. Okay? Fresh fruits and vegetables. Good fats, good seeds, good nuts, okay? And all that is kind of broken down right in that brochure for you, right on the inside. So if you open that up, we kind of broke it down on what to eat and what to avoid. So nothing crazy, nothing exotic, but you just have to consistently be taking those foods. When we're not eating those foods, when we're eating the processed foods, the fast foods, the sugary foods, over time can cause all kinds of problems. Yeast, parasites, toxins, intestinal deterioration, all can occur over time. So we want to clean up the diet first and foremost, and that again is very critically important. And that's why these are called supplements. Supplement your diet and lifestyle. So you can't just take a supplement and then go eat these bad foods and expect changes. Because if these foods are actually the triggers for this inflammation, then we're just kind of spinning your wheels. And we don't want to waste your money or waste your time. We want you to get the fastest, quickest results. So that's why it's really important that we always look at the food first and foremost. Now, the other critically important thing about your stomach, your intestinal tract, is your immune system. Approximately 70% of your immune system is in your GI tract. And I've actually seen some studies recently that's now saying it's up to 80% of your immune system is in your GI tract. Okay? So obviously this is cold and flu season right now. Big, big issue. So that is the reason why one of the reasons why we recommend probiotics. Probiotics are the good bacteria which fight the bad bacteria in your gut And this battle is constantly going on every single day of the year. And so probiotics are not just something you should take if you've been on antibiotics or if you have some type of stomach issue, but it should be something you should take every single day of the year. The other issue with the gut is your serotonin, which is your neurotransmitter, which most people think is in your brain, which there is some in your brain, but 90% of your serotonin is also formed in your gut. In your gut. And this affects your mood. This affects your sleep. And I had a whole talk about this the other day. But again, that's another area that why your gut is so important. Okay? Now, we know this is one of the reasons why many people see doctors. In fact, statistically, 70 million people suffer some sort of GI problem. There's 300 million people in the United States, 70 million have some type of GI problem. So, more than 1 out of 4 people. So, if you have a GI problem, you're not alone. Many, many, many people have these type of issues. And again, this is really the underlying issue, so many other problems. And what's going on in your GI tract is that normally macromolecules that would be in your intestine actually leak out through your gut and they start attacking your other organ systems, which lead to other health issues. And we call this issue, this is known as leaky gut syndrome. Leaky gut syndrome. So this is becoming more and more, people are recognizing this name, but it affects all inflammatory conditions, and it leads to autoimmune issues such as rheumatoid arthritis, eczema, food allergies, irritable bowel, just to name a few. Okay? So often people ask me, you know, I have eczema, what do I do? We fix your gut. And they look, well, you're telling me, I'm asking you about a skin condition, and you're giving me a GI formula. Why is that? This is why. Because it's an inflammatory issue first and foremost with the stomach, first and foremost. So we fix the stomach, a lot of these other issues will be greatly diminished or completely gone in just a few months, in some cases weeks, if we fix the gut. All right, so the normal function of the GI tract is that it should not have these type of health issues. But here's another reason why so many people are having GI problems is the self-medications, the NSAIDs, the non-steroidal anti-inflammatories, such as aspirin, such as Tylenol, ibuprofen, Advil, naproxen, okay? Does anybody know how many days that you should take these NSAIDs maximum in a row? Anybody? 2 days? 3 days? 3 days. 3 days. 3 days, 72 hours. It says it right on the directions on the insert. Do not take for more than 72 hours unless you consult your physician. Unfortunately, your physician will say keep taking them because they don't know any other options. Why would they do this? Because there's been studies that have shown after 3 days of taking the NSAIDs, it starts causing peripheral tears in your GI tract, lesions, bleeding of your GI tract, ulcers, after just 3 days of taking these non-steroidals. And so many people are not only taking the non-steroidals, but now they're also taking other issues like the heartburn medications, like antacids, like Nexium, Prilosec, all those type of medications as well. Okay? In fact, almost half the population self-medicates with these type of medications. Does anybody know how long you should take these type of medications? Anybody like to guess? 2 days? Nope. Anybody?
I'd say don't take them at all.
Well, we'd like for you not to take them at all, but 14 days. 14 days with the heartburn medications, the Nexium, the Prilosec, the Zyrtec, okay? What happens after 14 days is that your body shuts down the stomach acid needed to break down food. You become dependent on these medications, and it's very difficult to get off these medications. Very, very difficult, okay? In fact, now Nexium is now over the counter. They've been advertising that. You don't even need a prescription for Nexium anymore. But if you look at the advertisement on that Nexium, if they just flash it really quickly, and the only way you can actually see this if you have it recorded and you press pause and you look at it closely, at the bottom of the screen it says, do not take for more than 14 days without consulting your physician. And again, your physician will have no other options. They have no background, no training in natural health and actually healing the body. They're only trained in pharmaceutical medications and surgery. That's their background. That's their background. So this is a big problem. This is, again, why so many people are having stomach problems is they're taking medications that they think are helping them that are only meant to be taken short term, only 14 days maximum, and now they're stuck. They feel they're trapped. Now, we can help you. It's a process, but the longer you've been on Nexium and Prilosec, the more longer process it's going to be. And you never want to go cold turkey. You want to work with your physician your prescribed physician on any of these ways that we can try to transition off of these. But this is a huge problem. Almost half the country is on these medications. In fact, the latest stats came out 2013. Nexium was the third most profitable drug in the United States in 2013. Guess how much money the drug company made off just Nexium in the United States last year? $1 billion? $2 billion? How much? Wow, that's a lot. 60. Wow. $5.5 billion. $5.5 billion the drug company made off Nexium. Okay? So, that's the battle. That's the battle we're facing with these medications. It's a huge problem. Huge problem what's going on there. Okay, so I mentioned the NSAIDs causes the damage to the GI mucosa, ulcers, lesions, bleeding. And again, 13 million people are taking NSAIDs every day. 50 billion tablets are sold yearly. So you add just those two things add up, and you can see why so many people are having stomach problems. Now we know, again, the GI tract is just an amazing, our human body is an amazing machine, but if we stretch out the GI tract from head to toe, the esophagus all the way down, it's over 900 square feet. It's basically the size of a basketball court that is in your body. Okay, so think about that for a second. It's pretty amazing when you think about that. But again, it's designed to allow health-promoting nutrients, molecules, good bacteria, beneficial substances through. However, if you have leaky gut, the molecules of all types are able to go around the cells, get into the circulation, and cause multitude of symptoms. And these, again, are some reasons why people are having these issues, besides what we just talked about. Corticosteroids, such as prednisone. Alcohol, excessive sugar, GI infection, stress also plays a role with GI issues. Long-term antibiotics, again, just to name a few. So this is just this big cocktail storm that we're associated with. So the leaky gut may be associated with what's called the activation of gut-associated lymphoid tissue, known as GALT. GALT. And the purpose of GALT is kind of like the Marines. So the first line of defense, against foreign invaders, antigens, pathogenic bacteria, toxins. But unfortunately, the gold is activated. It causes all these type of reactions that occur. And basically, it does its job too well. So it produces cytokines, attacks the immune system. It fights the foreign invader, but it also destroys the good tissue as well. It does its job too well. It overactivates. And then it starts damaging your other organ systems and your other tissues, which again is why the GI tract is associated with all these other health issues going on. So people might not think about that before, but that's how it all is connected. It's all connected to the stomach. Okay? So here's a really simple analogy that I always use for leaky gut. Think of your stomach lining as like a screen door, okay, in your kitchen. What's the purpose of a screen door? To prevent bugs from getting in the kitchen and causing all kinds of havoc, right? When we do these kind of things, excessive use of all the poor diet, the drugs, the NSAIDs, starts causing holes in that screen door, which then the bugs get outside that screen door, okay, and start attacking the rest of your body. So we want to come up with a solution that's going to fix that screen door, okay? Heal it. The drugs do not heal that screen door. They just block it. And when they block it, that causes other types of problems that occur later on, the side effects from those medications. So that is the difference between our approach and the medication approach. But does that make sense, everybody? Fixing that screen door, that's what we're trying to do here. So we can do a lot of that fixing. We can fix that screen door with just one formula. And that formula is called GI Complete. Okay? GI Complete will do most of that healing process. It's very, very unique. It's the most comprehensive formula that we have ever seen in the nutritional world for healing any type of stomach issue. Yes?
Does it help with inflammation?
It will help with inflammation. Yeah, inflammation of the gut, absolutely. Absolutely. And typically we start with 2 scoops a day, or we also have it in capsules as well. Yes?
When you're saying gut, are you just saying stomach only or intestinal tract and everything?
The entire intestinal tract. Yes, the entire intestinal tract from Barrett's esophagus all the way to colon. This will heal. This will heal. Covers the entire GI tract. So we start with 2 scoops a day, 1 scoop in the morning, 1 scoop in the evening, until that condition has been under control. And then once you feel better, then we back it down to 1 scoop. Kind of tastes like Hawaiian fruit punch flavor. We also have it in capsules as well if you prefer capsules. So I'm just going to pass that around for you. If you haven't seen it, check it out. And we'll go over in more detail what it does and how it does. We also would recommend probiotics, as I mentioned earlier. Again, probiotics, the good bacteria, and digestive enzymes. That's really the core program of the GI, of our GI solutions right there, those 3 things. GI Complete, probiotics, and digestive enzymes, and we'll go over some of those here in a moment. In fact, let's go over some of the differences in probiotics, right? So we have, normally we have 4 probiotics. We're temporarily out of the Probzyme right now, so we are out of that one, but we have a lot of other options. So our basic one is the Frontier Biotics. So temporarily this would take the place of the Probzyme, okay? This is guaranteed 5 billion per capsule, dairy-free, probiotic. Typically 2 a day if you don't have any major issues, 6 a day if you did this one if you had any major issues, okay? So this is 180 capsule size, so if you're doing 2 a day, this is a 3-month supply. So that's a very good value, of course, for the whole family as well. Okay? Yes, sir.
Would you be taking those in addition to the GI?
Yes, this would be in addition to the GI Complete. Yes, correct. So it's really a 1-2 punch, so to speak, to really aggressively heal the stomach. Yes, sir. Yes, ma'am.
Would you have to go through a cleanse first before you do all of this? Or not necessarily?
That's up to you. You know, again, some people go through a liver cleanse first, detoxify the liver. You can do that, but some people start with the GI first. You can do either one. If you have GI issues specifically, though, I would do the GI program first and foremost. Okay. Now, if you have major GI issues, what do we mean by major GI issues? Colitis, Crohn's, irritable bowel, and celiac. We would go with the superbiotics. The superbiotics is guaranteed 52 billion per capsule. Okay. So we would dose this 2 capsules a day initially. And then once you start feeling better, we drop it down to 1 capsule. And then we would transition to the regular probiotics, the Frontier Biotics, when you finish this bottle. Okay? But we want to be more aggressive if you have major inflammatory issues. Okay? So I'm just going to pass that around for you, the superbiotics there. And then the last one that we have available in the probiotic line is called SBC. SBC stands for Saccharomyces Boulardii. This is technically this is classified as a probiotic, but it's actually a yeast. But it's a good yeast that actually pulls bad yeast from the body. So we would recommend this. There's a couple different ways we would recommend this. Number one, if you are on an antibiotic, this has the most research to reduce antibiotic-associated diarrhea. And you can take this exactly the same time as your antibiotic. You do not need to space it out. And it would be 3 a day. Hold on. The second area that we would recommend this for would be for Candida yeast issues. And we would recommend this with our Candy Kill formula for Candida, which we feel this is the strongest Candida formula on the market. So these two would work together for any type of Candida yeast issues. Which, by the way, I was at a seminar a couple months ago. The doctor who spoke said that 3 out of 4 females have Candida overgrowth, and 1 out of 2 men have some dysfunction Candida overgrowth as well. Okay, 3 out of 4 women, 1 out of 2 men. So that is also where the SBC would fit in. Third area that we would recommend this with would be a bacterial issue called C. diff, which is running rampant in hospitals. In fact, last year, 2013, Pittsburgh hospitals reported that it's an epidemic, is C. diff. Okay? And this has the most research to prevent that. It is transmittable from patient to visitor. When you go into the hospital and they breathe on you, it is transmittable. It's also rampant in nursing homes, is C. diff. So this has the most researched probiotic that we would recommend for C. diff. By the way, C. diff, you go into the bathroom constantly. Diarrhea 10, 15 times a day. Maybe 20 times a day. That's your symptoms for C. diff, by the way. Okay? Major issue. Third area, if you're going traveling anywhere where the water quality isn't the best, such as camping for the weekend or going to Mexico, anywhere such as that, to prevent Montezuma's revenge, which is again another type of GI problem, we would recommend 3 a day before you go, and then while you're traveling, you continue to take 3 a day, okay, to prevent any of those type of GI problems. This does not need any refrigeration whatsoever. Okay, because technically it's not living bacteria like the other probiotics are. You could go to the desert and take this, no problem at all. But those are the areas that we would recommend the SBC over the other types of probiotics. Does that make sense? Any questions on that? Okay. Here's that Candy Kill too. I'll just pass that around for you to check out. Okay, so again, we know it enhances the immune system. It's antimicrobial as well. Now, the whole program that we help GI dysfunction is called 5Rs, 5R program. So each one of these represents a specific area that we're focusing on. So first, we're removing. We're removing the offending substances, food allergens, pathogenic organisms. So this is where food allergies and food sensitivities really play a role with your diet. So we would really, really recommend, if you have any type of inflammation in your GI, that we do a food elimination in your top food allergies, dairy, okay? And when we say dairy, we want to be crystal clear. No milk, no cheese, no pizza, no ice cream, no yogurt, no commercial butter, no commercial eggs. Those are your top food sensitivities. Now you might say, well, I can drink that, I can do it all the time. It's not until you eliminate those from your program and then you add it back in one at a time, then we can really see if you actually have a food issue. Or you can get tested by Dr. Weiner here. He does food allergy testing and he does food allergy treatments. But those foods we would really recommend. So we go organic butter, or organic eggs, or cage-free eggs, but not commercial eggs. So when we say dairy, we're talking about all of those things, okay? Gluten, the protein from wheat, soy protein, corn, peanuts, and shellfish. Those are your top food allergies or food sensitivities. So those are very, very important when we're talking about removing the offending substances. That's what we're talking about. And then over time, we just, like I said, we reintroduce those one at a time and see how your body reacts. All right, replacing lacking digestive enzymes, fiber and stomach acid. Third, reinoculation. This is where the probiotics fit in, replacing the good bacteria. Fourth, repairing, regeneration of that GI mucosal tract, fixing that screen door right there. This is what, again, the drugs do not do. They do not repair anything. Nothing. So we want to, again, emphasize that. And then relief, okay? Relief of acute issues, especially acid reflux, heartburn, indigestion, minor things like that. We can repair those very easily. So there's the complete program, putting it all together, the 5 R's. So supplemental-wise, we have different options for each of these. Microgon, GI Complete, SBC, Frontier Fiber, Lean Greens. All of these will help in some capacity for removing. Okay, so we talked about that already. Replacing our fiber, dietary fiber. Ours is called Frontier Fiber. This is a very unique fiber, by the way. It's called Fibersol 2. It's patented. It has the most published research of any fiber in the world. Majority of fiber on the market actually raises blood sugar. This does not. It's odorless, it's tasteless. 1 tablespoon is equivalent to 5 grams. And especially if you have constipation issues, it's always good to add fiber to the diet. And again, you can put that in anything. Betazyme. So betazyme is our digestive enzyme that specifically focuses on gallbladder. So if you do not have a gallbladder, this right here would be the #1 supplement for your body, okay? The main function of a gallbladder is to remove excess bile, excess fat from your body, okay? If you do not have a gallbladder, you have extreme difficulty doing that. And so you have difficulty even taking fish oil. And it often comes up on you. So from time to time, I'll have some people say, I can't take fish oil. I ask them why, and they say, well, it comes back up. I burp it up. And I always ask, do you have a gallbladder? And 9 out of 10 people will say, no, I don't. How'd you know? Because that is the main function of the gallbladder. So this is a game changer. It's a lifesaver. If you do not have a gallbladder, you will feel that immediately, like the first day that you take this. It's one with each meal. But there's other digestive enzymes in there as well as to also help break down food too. So in the meantime, while we're waiting for the Sabzyme, while we're waiting for the Probzyme, which hopefully should be in shortly, We are recommending the betazyme as our digestive enzyme because, again, it does have some digestive enzymes in there. Re-inoculating, again, the good probiotics, the GI Complete, and again, all the other probiotics that we talked about. Our greens also helps to re-inoculate us too. Repairing that screen door. The GI Complete again, the fiber greens. So you're seeing a constant theme here with the GI Complete. It works on every one of these R's. And that's again why it's such an amazing formula. And then again, for acute relief issues, acid reflux, heartburn, indigestion, you can really do the probiotics, the Frontier Biotics and the betazyme I would use. For diarrhea, especially antibiotic diarrhea, the SBC and fiber can help with that. The constipation issue, we do have another formula for constipation. It's called Frontier Cleanse. Frontier Cleanse. This is our colon cleanse. It's very simple and easy. We recommend 4 capsules 1 hour after dinner. If you do not have a bowel movement that night or by the next day, you bump it up to 5 capsules. If you still don't have a bowel movement the next night, you bump it up to 6. But most people, 4 does the trick. And whatever dosage it takes for you to have a bowel movement, we just stay at that dosage until you finish the bottle. It's very, very simple and easy. Again, you should be having a bowel movement every single day. Every single day. In fact, some doctors that I work with feel that you should be having a bowel movement for as many meals as you eat a day. But we'll just stick with one. Let's start with one first on those issues, okay? So if you're constipated, that would be the area that we would start with. That is our colon cleanse, Frontier Cleanse. Okay, so there it is in a nutshell. So the GI Complete, as I said, 2 scoops to start with, then back it down to 1 scoop. And the Frontier Biotics for minor issues, the Super Biotics for major issues. And our digestive enzyme right now, while we're waiting to get the Probzyme and Cyberzyme back in, would be the betazyme. So we really try to simplify this for you with this program. So let's just break down the GI Complete briefly just so you can see exactly what's in this and why it helps with all those issues. So the first ingredient is L-Glutamine, which is an amino acid. This helps on a lot of different issues, but it helps for the regeneration of the GI mucosal cells. It also helps as far as healing the muscle tissue. So your stomach lining is a muscle, so it literally helps to fix that screen door. And by the way, our powder has 5,000 milligrams or 5 grams. A lot of the supplements on the market, GI products that contain glutamine, only use between 1 and 3 grams. So we're using a very high dosing, much more than most companies use. Second ingredient is arabinogalactin, which is a long-sounding word. It's the active ingredient of echinacea. So this actually helps support the beneficial bacteria and helps with regularity. Dimethyl Glycine, which I have a talk on this a few days ago. This has a lot of different health benefits, but it's an anti-inflammatory, it's a methylizer, and anything that you combine with it, any nutrient, it will make it more efficient, more absorbable. And so it's kind of like adds fuel to the fire. Deglycerized licorice. Deglycerized licorice cools down the inflammation, and especially if there's a lot of stress involved there. Helps to soothe and relax the intestinal tract wall. Aloe vera, which we do sell separately, but it's antifungal, antibacterial, antiviral. Also helps with the stress and detoxifies the pockets of the colon. So think of your colon if you're having these GI issues is kind of like like Route 28, major potholes. So this aloe vera just kind of comes along and just smooths it all out and heals the lining of that stomach. Okay. Slippery elm also has many functions, very similar to aloe vera, antibacterial, viral, and fungal. Also detoxifies as well. Marshmallow root, again, very similar. This is not the marshmallow that we're making s'mores with. This is an actual herb that's been used for centuries, thousands of years. Again, very soothing on the intestinal tract and also detoxifies as well. And then this ingredient, zinc carnosine. This is very, very unique ingredient. It's not just zinc and it's not just carnosine. It's a special bonding process that actually makes it 3 times more absorbable than just using those individual ingredients. But this actually has over 20 published studies just on this one ingredient that's been shown to repair and protect the gastric mucosa. And for indigestion, in 8 weeks, it's been shown 92 to 100% improvement in just 8 weeks. So just on that one product alone, or one formula alone, it's very, very helpful for. So with the GI Complete, you can see all the different ingredients in there and why this is so beneficial. In fact, the company I used to work for, this was 3 formulas. 3 different formulas that we combined into one to make it that much easier for you on that. So that's pretty much the gist of it there. And we broke it down in the brochure just like we talked about. The foods are right there. The program is right there. Give this a chance, okay? So any questions on any of that we talked about? Does that make sense? Okay. So I made some extra copies. If anybody has a family member or friend or neighbor wasn't able to attend, please come up and help yourself grab some more there for you. Yes, question.
Okay, say you have some of those symptoms on there. Can you just start the program, or should
Yeah.
you talk to someone first?
Well, it depends. If you have multiple issues, that's your choice. We do always recommend you make an appointment. You can see Jamie here on Monday or Dan here on Tuesday, because there could be some other underlying issues. And if you're on medications as well, even though all these things are safe medications, it's just nice to see what's going on there. But yeah, absolutely, you can definitely start these. You can definitely start these without meeting anybody. It'll definitely help you and get you going in the right direction. Okay? All right, folks, my time is up. Thank you. I'll be in the back again. Appreciate it. Have a wonderful evening.